My name's Paul Haslam. I'm a consultant orthopaedic surgeon specialising in knee surgery and work at Park Hill Hospital in Doncaster. I've been a consultant now for over 10 years, and during that time I've gained a lot of experience in treating the whole range of knee conditions. Patients often present to me with knee pain. These may be older patients who've got knee arthritis and may have been referred for consideration of a knee replacement operation. Now, the first thing I'll do when assessing a patient such as this is, following a detailed history and examination of the patient, is to find out what conservative measures they've had already. Simple things like physiotherapy, anti-inflammatory tablets, the odd injection, a brace or a bandage, and weight loss may be all that's required, and we really only perform surgery if absolutely necessary. The sort of patients that may require surgery will be the ones that will be having pain at night, pain at rest, or really struggling to walk only a few yards. And if you fall into that category and your x-rays show that you do have very severe arthritis, then a knee replacement is a good option for you. Often patients have heard of the term bone-on-bone arthritis. Bone-on-bone arthritis means that your knee is worn out. There's no cartilage and the bone is now rubbing on the bone. That can become very severe and you can start to lose bone stock, and your knee may become more deformed. You may have a bow-legged deformity or a knock-knee deformity. If you notice that your knee's becoming very deformed, then you really should see someone fairly urgently. A knee replacement operation is a relatively standard procedure now, and this is a model of a knee replacement. As you can see, this is a hinged joint. During the surgery, the bones are prepared to accept the components. Approximately 1 centimetre of bone is removed from the tibia and 1 centimetre of bone removed from the end of the femur. The femur bone is then shaped. Tibia is prepared with a drill and then a punch. The tibial component, or the shin bone component, is then cemented in place. The femoral component is cemented in place. And the knee joint reduced. As you can see, the knee is held together by your ligaments. It's not connected in any way. So on the day of the surgery, I will come and see you. We'll have a quick chat. Any last minute concerns can be addressed, and I'll place an arrow on your leg. You'll then be taken to theatre. The whole process normally takes about 2 hours, the surgery being about 1 hour. Now, the knee replacement itself is done through a largish incision over the front of the knee, straight down over the knee joint, and it's always numb to the outer side of the knee after that. And we replace the worn bits of bone. So we cut away the damaged bone and we replace that with partly metal and partly plastic. After the operation, you should be relatively comfortable, as the spinal anaesthetic and the local anaesthetic that I've put into your knee should still be working. Day one can be a tough day after knee replacement. Your knee will be a little bit swollen, but we will remove the bandages and encourage you to bend and straighten your knee. I also encourage you to bend and move your foot as much as possible to decrease the risk of getting a blood clot in your leg. The physiotherapist will see you and instruct you on how to bend and straighten your knee, and you will be encouraged to get out of bed. By day 2, you should be able to walk around the ward, and then by day 3, we'll expect you to have conquered the stairs and be ready for discharge with just tablets as painkillers. For the first 2 weeks after your knee replacement, you're a bit limited, and you're often just in the house or pottering outside into the garden. Between 2 and 6 weeks after the knee replacement, you start to get a bit more adventurous, maybe walk to a local shop and do a little bit more walking, maybe walking up to a mile. After 6 weeks you can drive, and you may be able to work after that time, but I would normally expect you to have 3 months off work following a knee replacement if you're of working age. Between 6 and 12 weeks after a knee replacement, if the wound's healing fine and everything is going well, then we'd expect you to start to do more walking, and perhaps by 12 weeks you should be able to walk maybe 3 or 4 miles. If you're a keen golfer, you might be able to play at that point. The knee continues to improve up to 12 months. You will be reviewed 1 year after your knee replacement operation. I will perform an x-ray to make sure that there's no concerns on the x-ray, and you'll have a clinical assessment to make sure I'm happy with your knee replacement. I'm very happy to see you again at any stage if you're concerned about any complications of surgery. If you're worried that you've got blood clot in your leg, bleeding from the wound, or any signs of infection, which are uncommon, If you have any concerns whatsoever, I'd prefer you to contact me. I've done the surgery, I'll look after you afterwards.